Hello everyone. Today I'm going to speak on the topic stainless steel crowns. The stainless steel crowns are semi-permanent restorations used in primary and young permanent tooth. So they were introduced by Humphrey in the year 1950. So coming to the types of stainless steel crowns, they are classified into untrimmed crowns and pre-trimmed crowns. The untrimmed crown example are the Rocky Mountain and the pre-trimmed crown example are the Denver crowns. The untrimmed crown, as the name suggests, they are neither trimmed nor contoured, thus they require a lot of adaptation and it is time consuming. The pre-trimmed crowns have straight, non-contoured sides. Still, they require contouring and trimming, but the sides are festooned to follow a line parallel to the gingival crest. Coming to the composition of stainless steel crowns, the stainless steel crowns or the 18 by 8 crowns are made up of Austen type of alloy in which 17 to 19% is composed of chromium, 67% iron, 10 to 13% nickel and 4% minor element is present. You need to know the composition of stainless steel crown and nickel based crowns. The stainless steel crown are made up of Austen type of alloy consists of 10 to 13% nickel, 67% iron, 17 to 19% chromium and 4% minor elements, whereas the nickel based crowns have 10% iron compared to 67% iron in stainless steel. They have nickel 72% compared to 13% in stainless steel. Chromium is almost the same, 16%, and the other constituents minor elements composed of 2%. So the indications of stainless steel crowns. They are used in cases where the decay is present in the primary and the young permanent tooth, for teeth that are deformed by developmental defects like dentinogenesis imperfecta and amelogenesis imperfecta, tooth with hypoplastic defects. Following a pulpal therapy, they are used as a preventive restoration for correcting single tooth crossbite in cases of bruxism, as an abutment tooth, as a temporary restoration for fractured teeth. So these are the indications of stainless steel crowns. So coming to the clinical procedure, the selection of the crown. The smallest crown that can fit the entire preparation should be selected. The mesiodistal dimension of the crown can be measured using a police gauge. So for the occlusal reduction, we can use a 69L or a 169L burr, and the amount of occlusal reduction that should be achieved is 1.5 to 2 mm. For the proximal reduction, you can use the same burr 69L or the 169L burr. For the proximal reduction, the burrs are moved in a buccolingual direction starting from the marginal ridge. So after the proximal reduction of 1 to 1.5 mm, the explorer tip should be able to pass through the sides easily. The buccal and the lingual reduction should be kept as minimal as possible, that it should be 0.5 mm. When compared to the buccal and the lingual side should be least prepared. So the rounding of the line angles should be done on the occlusobuccal and the occlusolingual aspect using the same 69L or the 169L burr that should be held at an angle of 30 to 45 degree to the cavo surface. Coming to the clinical procedure, the adaptation of the crown was proposed by Spading in the year 1984. So crown contouring, initial contouring is done with 114 plier. It is also called the ball and socket plier, which produces a belling effect in the middle 1/3 of the crown. So if this is the crown, imagine this is the proximal side, the ball and socket plier will produce a belling effect in order to simulate the natural contour and the contact. So the 112 Abel's plier can be used to correct the contact. If the contact is not correct, then the 112 plier can be used to exaggerate the contact in order to establish proper contact with the adjacent tooth. The adaptation at the gingival 1/3 of the crown is established with the Gordon's plier. That is the 137 Gordon's plier. The crown crimping can be done with the 800 to 412 pliers. So the initial contouring of the crown is done with the 114 plier, which is also called as the ball and socket plier, to produce a belling effect on the side. Then the proper contact is established with the 112 pliers, and the adaptation at the gingival 1/3 is established with the Gordon's plier. The crown crimping can be done with 800 to 412 pliers. Checking the final adaptation of the crown. The crown must snap into place. The crown should fit so tightly that there should be no rocking. The crown in proper occlusion should not interfere with the eruption of the succedaneous tooth. There should be no high points after evaluation with the articulating paper. The crown margin should extend 1 mm below the gingival crest. There should be no opening between the crown and the tooth cervical margin. So the crown should snap into place and should fit so tightly that there is no rocking. You check for high points, have proper occlusion. The margins should be placed 1 mm below the gingival crest, and there should be no opening between the tooth and the cervical margin of the tooth and the crown. For cementation of the crown, you can use the zinc oxide eugenol, the zinc polycarboxylate paste, or the zinc phosphate paste, or the glasenomous cements. So coming to the modifications of the stainless steel crown. Now think of an undersized tooth and an oversized crown. That is, the crown that is going to be fit on the tooth is oversized and the tooth is small. So we have to reduce the circumference of the crown. This can be done by splitting the tooth at the labial surface and making a cut on the labial surface towards the occlusal surface. I'll show it to you. So you make a cut on the labial aspect from the cervical portion to the occlusal surface such that the two halves can be overlap each other in such a way that the circumference of the crown is reduced. So these modifications were put forward by Mink and Hill. So what if the tooth is oversized and the crown is undersized? In such a case, we make a similar cut in the center, and so the two separations cut that is made, and after enlarging the crown by placing a small piece of orthodontic wire that is 0.004 inches in dimension, and this can be welded onto the facial surface. In case of a deep subgingival caries, we can do the required pulpal treatment and then restore with amalgam restoration. In case of an open contact, we can either use an exaggerated oversized crown, or you can use the Abel's plier to produce an exaggerated contact with the adjacent tooth. The open face stainless steel crown is used for anteriors where the facial part of the stainless steel is removed and it is restored with a resinous material. So these are the dimensions for the tooth preparation. For the occlusal part, it should be 1.5 to 2 mm reduction is required. For the buccal and the lingual aspect, minimal preparation is required, that is 0.5 mm. For the proximal, 1 to 1.5 mm reduction is required, and the gingival termination should be 0.5 to 1 mm into the gingival sulcus. Now let's discuss the previous year questions. The restoration of choice in endodontically treated primary second molar in 9-year-old child is a stainless steel crown. So the iron content in a stainless steel crown is, which I told you there are stainless steel crowns and nickel based crown. The iron content of stainless steel crown is 67% and that of the nickel based crowns is only 10%. So the answer for this is C. The stainless steel crown should normally extend below the gingival crevice approximately 0.5 to 1 mm below the gingival crest. The option A. The stainless steel crown was introduced by Humphrey in the year 1950. Option A. The stainless steel was introduced for the construction of orthodontic appliances by Burstone. You have to learn that by heart. So retention of the stainless steel crown is achieved by the parallel walls of the mesial and the distal surfaces. The mesial and the distal surfaces of the cavity brush should be kept as parallel as possible with slight occlusal convergence. So the method of modifying the stainless steel crown was given by Mink and Hill. The stainless steel crowns are contraindicated in medically compromised patients after endodontic surgery, rampant caries. The answer for that is medically compromised patients. For the selection of a stainless steel crown, which of the following is not a criteria? There is the mesodistal dimension which should be measured. We should check for light resistance during seating. We should check the crown height, but no need to check the occlusal morphology. Who discovered stainless steel? Stainless steel was discovered by Brierley. So that concludes my preparation. Thank you.